Welcome back to Dianne Yoga. If you're facing knee surgery, you want to be able to recover quicker by keeping the muscles strong surrounding the knee. And the time is to begin perhaps before the surgery. We'll call it pre-hab, before you do the rehab. So what you want to do is get a nice mountain pose seated, just strengthening the quads and the glutes, you'll see as we go along. Just a few minutes each day. I would say dedicate 10 to 15 minutes twice a day for a few weeks preceding the surgery. And increase that over time. So each repetition might be 5 to 10 the first week. The second week you may increase it 10 to 15 times. So find that place where you are comfortable, and remember, never ever get to the point of pain. We always breathe and find that edge in yoga where the quality of your breath is what guides exactly where you should be on your edge. You'll see. So coming into seated mountain, get nice and tall, draw the shoulders back, and just feel the abs engaged just to keep you tall. Posture, posture, posture. We're going to strengthen the quads by simply engaging them. So we're going to press the heels into the mat and the big toe into the mat and just engage the quads. Feel them come to life and then relax with the breath. So we inhale, hold the quads, squeezing, exhale, release them back down. You're keeping the core slightly engaged so you're not coming forward in your torso. Engage the quads. 2, 3, 4. Relax. Inhale, engage the quads. 2, 3, 4, and relax. So take notes. Make number 1 be quad engagement and 5 to 10 breaths. Moving on, we want to keep the hip flexors strong, abductors and adductors. We're going to take a block, a yoga block, a coffee can, a small ball perhaps, and just place it gently between the thighs, below the knees. Coming a little bit more to the edge of the chair, shoulders are back, hang on to the chair if you need to. Same principle of breathing. Press the feet into the mat, inhale, squeeze the block. Make sure it's not the knees, you're feeling the thighs activate here. Exhale, release, but don't drop the block. Inhale, squeeze the block. 2, 3, 4. Keeping the low belly in, the chest drawn up. Exhale, release the block. Inhale once again, squeeze that block. Pre-hab before rehab. We're going to get through this easy. Relax. Press and squeeze. 2, 3, 4. So we're just doing 5 together, and release. 1 more. Keep your gaze steady, concentrating somewhere. The quality of the breath. Remember, inhale, squeezing. Maybe you add your low belly a little bit more. And then exhale, nice and slow, completely. Number 2, block squeeze. 5 to 10 the first week. Perhaps, as I say, that increases over time. The second week, 10 to 15, etc. Moving on to a little more of the quad strengthening, we're simply going to lift the right leg and bring that leg as parallel with the earth as possible, keeping the shoulders back. Hang on to the chair so we're not rounding to lift the leg, we're bringing the shoulders back. Feel that quad engage, release. You can do both legs to keep them equal, or just do the one that's going in for the treatment. And release it back down. Other side. Inhale, pull the belly in, lift the pelvic floor just a little bit, bringing the shoulders back, and exhale. We'll do 2 on each side. Hanging on to the chair or the seat. Feel the heel extending. Don't bend the knee completely. Find that place where it's comfortable. Exhale, bring it back down. Mountain pose. Seated mountain. Just means that you're equal in your sit bones and your shoulders are drawn back over your hips and you're nice and tall like a mountain. Posture. The last seated pose would be to take the leg of question, or both of them, like I said, and just draw the toes back. Bring that flexion back into the top of the foot and just allow the quad to stretch, sitting back just a little bit. Remember your point of comfort. Just stretching that quad out just a little bit, feeling your breath coming in and going out, nice and calm and easy. Ideally, the count of 4 as the breath comes in, and exhaling to the count of 4. Other side. Taking those toes and bringing that knee back. Just allowing the knee to drop away from the hip, opening up the whole front thigh there, breathing. One more. And exhale, bringing that foot back to center. So we've just strengthened and lengthened the quad area. Time to move on. Just a couple standing poses here. You want to be very careful to make sure that your knee is not locked when you're standing and you're not bent a little bit too much when you're standing. Your joints are stacked. Hanging onto a chair about hip distance. This might be a little bit too low actually for my height. A countertop. And we're just going to engage the glutes. Another really important part for rehab, for walking. Let's get them ready by pre-habbing them. So take your weight, think about your center line, your plumb line heading right down the middle of the body, around the belly button. And just picture that plumb line as you gaze steadily, bring the shoulders back, and just flip that plumb line over to the left foot. The big toe ball mound presses in, and just engage the heel and the big toe into the mat, and you feel the left quad come and engage. Perhaps you lift the right leg, coming forward, engaging that quad, shoulders back, press the heel down, press the big toe down, pull the belly in gently, and release it back down. Just a little shifting of the weight. You needn't even take that foot off the floor. Depending on where you are, your comfort level, that edge I talked about, that quality of your breath that brings you to the moment. So taking the weight again, picturing it in the center line, shifting over to the right. We're going to press that right foot into the mat, engage that quad. Feel this left gluteal area engage, pressing the heel into the mat, holding on. Perhaps your left leg comes and hovers, bringing the foot flat onto the mat or the rug or the floor, and release it back down. Just about 5 seconds. So shifting back and forth. Perhaps your foot doesn't even come off the mat, and you just feel that engage as you push the heel down. You feel the quad engage, shoulders back, and at the same time lengthening out the spine, like a necklace is hanging you, like a string of pearls from the ceiling. And release it. We'll shift to the other side. Draw the heel in, lift from the mid-body, engaging that whole thigh, gluteal area. Breathing, perhaps you lift that leg and hold, and release it back down. The last standing pose would be to keep your mountain pose on, feet, hips, shoulders in line, hanging on firmly, weight shifts to the left foot, and we just simply take the right foot and draw it back. Point the toes, perhaps, and just feel that quad engage. Nice, strong, help with your arms, and release it back down. Other side. Shift into the right foot, press that foot into the floor, and lift the left toes behind you, pointing perhaps. So inhale, lift, up and away. Nice, strong standing leg. Exhale, bring it back down. Just coming back and forth on each side. Again, 5 to 10 times on each side. Make sure you're holding on for support, especially when it comes to standing on that knee that needs the surgical procedure. Perhaps you don't even take that foot off the mat because it feels intuitively like it would be too much. You just engage, pressing the heel back and back to center. And that's it for our standing poses. There's one more level to take it to, and that is on the floor. We're on the floor now. A wonderful exercise for the hip abductors is the clam. You can bring your arm out, lying on your side. Bring your head to the side of your arm. Whatever's comfortable for you, tucking your arm. The key is to make your knees on top of each other stacked. Bring your hand comfortably in front of your support, and keeping your heels and your big toes together, we're simply going to inhale and lift that thigh up. Exhale, bring it back down. 5 to 10 times. Inhale, bring the thigh up, keeping the opposite one flat on the mat. Exhale, this involves some core. Inhale, lift. Nice clam opening to the sky. Exhale, we'll just do 5. And this goes on each side. I'll be writing these down so we can visit them this afternoon or tomorrow morning, whenever you're finding your time. Twice a day. Inhale, lifting that thigh. And exhale, bring it back down. And the second floor exercise would be to lengthen out the whole body, keeping the joints stacked, hips stacked, knees stacked, feet stacked. We're just simply going to raise the right leg, keeping the knee facing straight ahead, just as the other knee is, and exhaling it back down. Only lifting enough so we don't rock back, keeping those hips stacked. Perhaps you go against a wall to keep you straight in line. Knees gently, just slightly bent. You never want to lock out the knees. And lift. 2 more. And if you want to do the other side, we got to stay balanced. And last one. And exhale it back down. One thing we shouldn't forget about is the core. If you want to add one more wonderful thing to your series of pre-hab before rehab, how about just a little bit of a plank? We can take plank into a modified version by bringing the shoulders right underneath, right over the elbows, and bringing the palms flat, the size of perhaps we're pressing down a tray. And press the elbows into the mat. We're simply going to tuck the chin and just peel the belly button up off the mat. We needn't come to our knees, but just peel the belly button up off the mat, spread the shoulder blades to the sky, and exhale back down. So just a little gentle opening of the back body to the sky, spread the shoulder blades, and just peel the belly button, perhaps the hips off the mat. Now come into the knees, bend the knees if you need to so you don't come onto your knees. Exhale back down. Last one, press your arms, forearms, palms into the mat, tuck the chin, spread the shoulders to the sky, and then peel the belly button, perhaps the thighs and hips come up off the mat. Make sure you're not on your knees. Pull the belly in, lift yourself up by the elbows, and placing those feet back down if they were up, slowly unfurl. Inhale, gazing up. Exhale, coming back to seated. Maybe just rolling onto your side. However you get there, that's safe for your knees. Modifications are invited. So let's take a moment to sit with our hands at heart center. Perhaps this position isn't allowed or comfortable for our knees. Perhaps we've come to our seat that we started in. Wherever you are, just take a moment to close your eyes. Come into your breath. Feel the energy around your thighs, your mid-body. Just feel the healing energy you brought up into your practice today for yourself. The highest in me honors the highest in you. Namaste.